In this session, we shall talk about vitamin E, also called as tocopherols. So first we'll see what is the structure of these tocopherols. This is the basic structure of a tocopherol. This is how a tocopherol will look like. So here there can be alterations in these positions. In these positions there will be alterations, that is 5th position, 7th position and 8th position. In all these 3 positions there can be alterations, and depending on that these will, or their names or their nomenclature will differ. We shall look at it over here. The tocopherols will differ from each other in the number or position of the methyl groups. For example, you see there is the first one being an alpha-tocopherol. It is called as, or the nomenclature is 5,7,8 trimethyl tocol. So how do we come to this name or this nomenclature? If we carefully look at this diagram, here there is an R group, R1, and here there is an R2 group. So we see that if in the position or in place of R1 there is CH3, there is methyl group, and in the place of R2 also there is another methyl group, then it will be an alpha-tocopherol, also called as 5,7,8 trimethyl tocol. Similarly, if in the place of R1 there is a methyl group and R2 there is a hydrogen, then it will be 5,8 dimethyl tocol, also called as beta-tocopherol. Similarly, if in the place of R1 there is a hydrogen and R2 there is a methyl group, then it will be 7,8 dimethyl tocol. And if there is hydrogen in place of both these in this R1 and R2 position, then it will be 8 methyl tocol, also called as delta tocopherol. But we can say that the alpha tocopherol is the most active in vitamin E activity. Now we should know that this vitamin E is also or acts as an antioxidant, and this is mainly because of the presence of this phenolic OH group on the 6th carbon of the chromane ring. This carbon is responsible. This is the 5th carbon which is responsible for giving tocopherol its antioxidant property or antioxidant activity. The dietary sources from where we can get vitamin E are cottonseed oil, corn oil, sunflower oil, wheat germ oil, and margarine. These are also found in fair quantities in dry soybeans, cabbage, yeast, lettuce, apple seeds, and peanuts. The recommended allowances for children are 10 to 15 IU per day, and for adults it is 20 to 25 IU per day. Special attention has to be given to the dietary intake of unsaturated fatty acids, in which case the daily requirement is increased. Requirement is also more in pregnancy and lactation. We shall come to know how or what is the reason for this statement through this next slide: absorption, distribution, and excretion. So this slide will give us the answer to the previous statement which we have made with respect to tocopherols and their recommended allowances. First of all, these free tocopherols and their esters are readily absorbed in the small intestine with the help of bile acids. Absorbed vitamin E is transported to the liver, where it gets incorporated into lipoproteins and carried by the blood to the muscle tissues and then to the adipose tissue for the storage. The normal value of blood levels is around 1 milligram per deciliter, and it's transported chiefly in the form of alpha lipoprotein fraction. Under normal dietary conditions, there is no significant excretion of tocopherols in urine or feces, as it rapidly and extensively causes destruction in the GI tract and tissues. Placental transfer of vitamin E is limited. Mammary transfer is much more extensive. Thus, serum alpha-tocopherol level of breastfed infant increases more rapidly than that of a bottle-fed infant undergoes. This is the reason why the requirement is more in pregnancy and lactation, especially during lactation. Next, we shall look at the various functions of vitamin E. The first one, as we have already mentioned, is its antioxidant property. Vitamin E is the most important, or has the most important property of antioxidant. It shows antioxidant activity, and the reason being its alcoholic OH or phenolic OH group. It is a phenolic OH group at the 6th carbon of the chromine ring. That's it. Thank you. We shall continue with the functions of vitamin E in our next session.